So I'm a rheumatologist, and a rheumatologist is a specialist doctor in arthritis. That is anything to do with bones, joints, tendons, ligaments, but we also deal with inflammatory conditions as well. Arthritis can be caused by lots of different things because there's lots of different types of arthritis. Osteoarthritis, which is the most common type of arthritis, is usually because of trauma to a joint, and that can be for whatever reason. It could be because of playing sport, because of twisting your knee and doing your meniscus when you were younger, or needing an ACL repair. That can lead then to knee osteoarthritis. It can be mechanics because you've had flat feet and you've been walking differently. It can be because of hip dysplasia as a child and you get hip osteoarthritis. So there's lots of different reasons. And of course then with age there's more and more trauma that can occur to various joints. They can get more osteoarthritis with age. It does rely on pain management. So it may mean anti-inflammatory medications. We try to use non-pharmacological measures, so non-drug measures, and that is exercise, keep the muscles strong around the joint to protect and support the joint. Try to minimise biomechanical effects, but keeping the joint moving is really important. It's really important to keep weight under control for osteoarthritis. We know that there is a link to cardiovascular disease. The same causes of cardiovascular disease are associated with osteoarthritis. So weight control, losing even 5% of the body weight, can make a difference as much as taking an anti-inflammatory medication. So that's super, super important. People can prevent osteoarthritis by keeping their weight healthy, by keeping themselves fit and their muscles strong. Of course, people who do sport where they're overdoing it, elite athletes, are more likely to get damage to their joints and osteoarthritis just because of that repetitive trauma. The second most common would probably be gout. Now, we all talk about the male who drinks a lot of beer and they get the gout, but women can get it too. It can be just because of kidney disease, which is probably one of the most common reasons why we see it, is because of the kidneys are not functioning properly. The other most common arthritis would be rheumatoid arthritis, and that is an autoimmune disease that tends to attack and destroy the joints. The rheumatoid arthritis, we rely on medicines stopping the immune system from attacking the joint. What we're seeing a lot more of is arthritis associated with viruses such as COVID. We see a flare in their arthritis sometimes after vaccines. So we're seeing also reactive arthritis due to a gastrointestinal illness, for instance. Unfortunately, we don't have a cure for arthritis. We have lots of really good treatments, particularly like for rheumatoid arthritis, for gout, for psoriatic arthritis, the types of inflammatory arthritis. We have lots of good treatments and more are coming on board all the time. For osteoarthritis, it's trickier. There's a lot of research going on, but we don't have a great cure. We can't reverse the damage that's been done. All we can do is manage the pain, keep people as strong as possible to manage their symptoms.